Welcome to Toronto Children's Services Train the Trainer module. This module will cover strategies that will assist you in supporting your program staff with understanding and implementing the new requirements. Let's review. In order to complete this module, you must have already completed the IPAC Tips and Considerations learning module, which includes hand hygiene practices, environmental cleaning, toy washing practices, and toileting and diapering practices. This module will cover strategies to support staff in implementing the following IPAC practices: hand hygiene, environmental cleaning, toy washing. We will also highlight some new important requirements and provide you with strategies to support staff. As a supervisor in this difficult time, part of your role will be becoming an IPAC champion. What is an IPAC champion? An IPAC champion is the leader who role models how to enforce the IPAC expectations. An IPAC champion leads by example and motivates employees to get on board with the new expectations. Your team will be looking to you to lead by example. You must demonstrate that you have knowledge of the expectations and that you will be there to support them. Hand hygiene. Let's review the IPAC requirements for hand hygiene. To wash your hands properly with soap and water, follow these steps. Wet your hands and apply liquid soap or clean bar soap. Rub your hands vigorously together, scrubbing all skin surfaces. Pay special attention to the areas around your nails and between your fingers. Continue scrubbing for at least 20 seconds. Sing the happy birthday song twice as a guideline for how long to wash. Rinse your hands and dry them well. Turn off taps with paper towel. Open the door of the bathroom with paper towel in your hand and then dispose of it in the wastebasket. You must wash your hands every time you enter a room, play outdoors, blow your nose or a child's nose, change a diaper, touch garbage, touch food, or touch your face or anyone else's. Here are some strategies to support hand hygiene among your program staff. Review and update your center's hand hygiene policy. Increase access to hand washing stations and hand sanitizer. Alcohol-based hand sanitizers with a minimum of 70% alcohol that have been approved by Health Canada may be used by children and staff. Adjust morning routines to review hand hygiene with children and staff. Stagger the time each room does it so that you as the supervisor can observe from the door and role model with the children as much as possible. Hand hygiene supplies should be monitored to ensure adequate quantities of liquid soap, paper towel, hand sanitizer, tissues, and waste receptacles lined with plastic bags. Environmental cleaning. Let's review the IPAC requirements for environmental cleaning. If a surface is visibly soiled, clean first, then disinfect. For cleaning, use detergent and warm water to clean visibly soiled surfaces. Rinse the surface with warm to tepid water to ensure detergent is removed. Let the surface dry. Disinfect surface using a solution such as bleach and water, Oxivir, or another appropriate disinfecting solution. Here are some strategies to support environmental cleaning amongst your program staff. Ensure all staff are trained on how to properly disinfect surfaces. When disinfecting, the minimum contact time for bleach and water is 2 minutes. This means the solution must remain on the surface for a minimum of 2 minutes before it is wiped away. Each cleaning product has a different contact time. Check the solution label to confirm the correct contact time is applied when disinfecting to ensure the killing of microorganisms. Surfaces that children have contact with, such as tables and chairs, must have a final rinse with a paper towel. This is important information to highlight with staff. A cleaning and disinfecting schedule should be in place with clear accountabilities assigned to specific staff. Staff should have a clear understanding of what PPE is required when completing those tasks. Identify all high-touch surfaces in each room with the educators who work in those rooms. Create a schedule for those high-touch surfaces where staff sign off every time it has been completed with the time in which they did it recorded. Establish a method to increase the frequency of cleaning and disinfecting objects, toys, and frequently touched surfaces. Remember, this must be done at least twice a day. Support your staff by ensuring every room has the proper cleaning supplies in a convenient yet safe location. Toy washing. Let's review the IPAC requirements for toy washing. Toys must be properly disinfected. When washing play materials, either a dishwasher or 3 sink or bin method can be used. Remember that all plush toys, porous toys such as toys that retain water, and sensory play items such as sand, water, and slime are to be removed from program spaces. Here are some strategies to support toy washing with your program staff. Ensure each program area has a bin for soiled toys and a method for removing those toys from the play area. It may be your new responsibility to either assign staff to collect soiled toys twice a day and wash them, or it may be up to you to assist in toy washing on a daily basis. To limit exposure, soiled toy bins can be placed in the hallway to be collected. A reminder, if at any point play material is mouthed by a child, it must immediately be removed from the program space. You can support the staff who are cleaning and disinfecting toys by going with them and doing it together if physical distancing can still be maintained. Be sure to revise the schedule used for toy washing. Now that we have finished reviewing IPAC practices, let's move on to new requirements. Additional information about personal protective equipment can be found under our PPE module. Personal protective equipment, or PPE, is equipment that will protect the user against health or safety risks at work, such as contaminated surfaces or affected droplet. Examples of PPE used during this time in early learning settings are gloves, face masks and coverings, face shields. Masks must only be used when required. This includes working in the screening area, working with ill children or staff, and when physical distancing is not possible, such as a diaper change or feeding an infant. Eye protection is task specific. For example, it must be worn during diaper changes or receiving a crying infant from the screening area. Here is what you as a supervisor can do in terms of PPE. Ensure the proper personal protective equipment is available for your staff in a convenient yet safe location. You will need to maintain a 1 to 2 week supply of PPE at all times. Make sure you are ordering from a high quality, reliable source. Review the intended and appropriate use of PPE with your staff. Help reduce the fear and anxiety surrounding the use of PPE. Role model and wear your PPE where it is appropriate. Create a checklist of when to use PPE within the program space. It's important to keep up with your staff and ensure they do not have any false sense of security due to some PPE. Be vigilant in reminding staff that they must follow all policies and procedures in place for their safety and the safety of others. Screening. Screening is a new requirement for services. Every staff, child, and visitor must be screened prior to being admitted into the program. Staff who will be doing the screening will follow the health screening checklist for each person and will record the outcome as pass or fail. Here is what you as a supervisor can do in terms of screening. Practice or role play the screening process with staff before your program reopens. It's important that your staff feel comfortable with the screening process, especially in the event of a yes response where you will be excluding a child, staff, or visitor from your program. Staff will need to feel like they have your support and that you trust them. Recap. Let's review the module. What do you need to have in your program space to ensure all IPAC requirements can be fulfilled? You will need hand washing, sanitization stations, proper cleaning and disinfecting solutions and equipment, more soiled toy bins, personal protective equipment such as masks, gloves, eye protection, and face coverings, a thermometer for your screening area, and to ensure all staff are trained and comfortable within their new roles. This concludes the Train the Trainer module. If you have any additional questions, please contact your district consultant or email qualityassurance@toronto.ca. Thank you.